Stress can affect our cardiovascular system, digestion, sleep, and more. But did you know it can affect the eyes too? We'll talk about some of the conditions that are linked to stress, triggered by stress, or can progress because of stress. If you're chronically stressed, you're likely to recognize at least one of these. Stress releases the hormones cortisol and adrenaline, and these were meant to help us survive in times of need by triggering the fight or flight response. But in the modern day, it seems that there's stress at every turn. So you can imagine how being chronically stressed and having these hormones be chronically high could affect our health. We're not exactly sure how stress can lead to eye problems, but there are a lot of eye conditions that have been linked to stress. Let's start with the big one that you might not have heard of unless it's already happened to you. Central serous chorioretinopathy is a condition where fluid accumulates under the retina, causing it to separate from the tissue underneath. This is different from a retinal tear, which more people may be familiar with, because in this condition, there's no actual tear in the retina. It usually occurs in the macula, so it affects the central vision, which can be significant in some cases. It can cause reduced vision. The typical range is from 20/20, which is normal, to about 20/80. It can also cause blind spots and distortion, but sometimes it's asymptomatic. Though it sometimes happens without an obvious cause, it has been associated with those with a type A personality. And that makes sense because we seem to stress a lot more. It's also been found in other situations where cortisol is raised in the body. This would be with steroids, even steroid creams or nasal sprays, as well as adrenal adenomas, which increase the production of cortisol. A lot of times the condition will go away on its own, and if someone's taking steroids, discontinuing those if possible will certainly help. Vision usually recovers to 20/30 or better, but in some cases where it's chronic or severe, treatment may be necessary. These next two eye conditions can be triggered by stress if you already have the virus living in your body. Herpes simplex, the cause of cold sores or genital sores, and herpes zoster, known as chickenpox at the initial infection, and shingles when it comes back later in life. Once you have one of these viruses, it never goes away. It lies dormant somewhere in the body and waits for an opportunity to strike. Sometimes that opportunity is stress. If you get cold sores, that means this herpes virus lies dormant in the trigeminal nerve. And the trigeminal nerve has three main branches, one of which goes to the eye. So when this becomes activated, it can affect the eye and in numerous places. The cornea, the conjunctiva, the eyelid, the retina, and it can cause inflammation that can lead to some serious complications. So it's really important to see your eye doctor right away because there can be vision loss due to corneal scarring or too much inflammation. So if you have sudden redness, tearing, blurring vision, light sensitivity, go to your eye doctor and get that checked out, and don't hesitate to share your full medical history. If you've had the chickenpox, the varicella zoster virus lives dormant in your nerves somewhere. It can reactivate later in life due to stress, a weakened immune system, or other triggers. It causes sores that affect just one area of the body, and it doesn't cross over the midline. This is because the body's nerve supply is separated into dermatomes. Dermatomes are sections of the body that are supplied by the same spinal nerve. If that dermatome that's affected includes the eye can be susceptible to infection as well, and the symptoms are similar to that of the herpes simplex virus. The first sign of this starting is neuralgia, which can feel like tingling or sensitive skin, or some say when it's on their head that brushing their hair hurts, but it's just on one side. So if you're experiencing these symptoms on just one side of the body, it could be a sign that shingles is starting, and it's important to call your doctor right away because treatment is usually more successful if started before the sores appear. There are some other conditions that can be triggered by stress but are, however, not infectious. One of them is acute angle closure glaucoma, and this is an ocular emergency. In this condition, eye pressure spikes up really fast because the eye is still producing fluid, but the drainage angle where it drains out is blocked. So fluid builds up really quickly and the optic nerve is damaged by this high eye pressure, causing vision loss quite quickly. It usually needs to be treated within 2 to 3 hours. Symptoms of this are blurry vision, headache or brow ache, nausea, vomiting, halos around lights, a red eye, and the pupil will be stuck in this mid-dilated state. Myokymia is when the eyelid twitches. We're not exactly sure what causes it, but stress is one of the triggers along with fatigue and caffeine. And those all tend to go in hand, don't they? It doesn't harm you, but it can get annoying. So sleeping, relaxing, and reducing caffeine intake can help. Migraines can be triggered by a bunch of different things, and stress is one of them. That includes ocular migraines, in which you can experience tunnel vision, blind spots, zigzags, flashes of light, and colorful rainbows in the vision. It can happen with a headache or without, which can make it really scary the first time it happens. Usually they last for about 20 minutes and vision will return to normal afterwards, though residual effects can cause blurry vision or a sort of fog for around a day. Some of these visual symptoms are similar to more severe eye diseases, so it's best to call your eye doctor, especially if it's the first time. Stress and psychological factors are significant contributors to functional vision loss, which can be caused by emotional distress, trauma, or other underlying psychological conditions. In functional vision loss, people may experience blindness or significant visual impairment, even though there's no evidence of anything going wrong in the eye or the visual cortex in the brain. This is extremely rare. Here are some honorable mentions that aren't caused by stress, but could perhaps progress more quickly due to stress. The first is open angle glaucoma. We just talked about a different type of glaucoma. In this one, the angle is open, but the results are quite similar. The optic nerve can become damaged, which affects peripheral vision and can progress. Stress may cause an increase in eye pressure, and brief changes in eye pressure aren't necessarily harmful, but if you already have glaucoma, a slight increase in the eye pressure may cause progression of that optic nerve damage. Stress has the potential to lead to dry eye. Chronic stress leads to inflammation, and dry eye, the basis of it is inflammation. So worsening inflammation could worsen dry eye. Cataracts are a clouding of the eye's natural lens. When you're under constant stress, it can lead to oxidative stress. And oxidative stress can lead to changes in the enzymes and proteins in the lens of the eye. So chronic stress could potentially lead to progression of cataracts. Oxidative stress also plays a role in diabetic retinopathy. So oxidative stress caused by stress may lead to progression of changes in the blood vessels that lead to leaking and swelling in the retina. Stress can also affect blood sugar, leading to progression. There is evidence to suggest that chronic stress may lead to the progression of macular degeneration because it can affect the body's inflammatory response and blood flow, which can lead to progression in macular degeneration, which affects your central vision. If you don't already have macular degeneration, you don't have to worry about it developing because of stress. This is for people who already have it. Remember, you shouldn't worry about developing these conditions because of stress alone, but if you already have them, it may lead to progression or have a negative effect of some kind. There are many other ocular complications that are caused by underlying health conditions, and a lot of underlying health conditions can be worsened by stress. So I could go on all day about how stress may cause or worsen this condition, and then this condition is going to worsen this eye condition or affect the eye in some way. The whole body is interconnected and it's all so complex, it's really hard to say. But I think the take-home lesson here is that if we can reduce our stress, we may be able to improve a lot of issues. There are also eye symptoms, not necessarily just conditions, that can also occur due to stress. One of them is sensitivity to light, where bright lights hurt your eyes or make it harder to see. But this can also be a symptom of inflammation or more serious eye conditions, so you should call your eye doctor if it persists. Blurry vision can occur at more typical stress levels, but also in the case of panic attacks, hyperventilation can cause blurry vision as well. Extreme anxiety may lead to tunnel vision. If you have floaters, stress may make you more aware of those floaters, though it's not going to cause more of them or make them worse. It's just in the awareness. Now, I definitely don't want this video to stress you out, but when has telling someone not to stress out ever worked? And it's hard to tell you to reduce stress by suggesting things like meditation and exercise because those things take time, and a lot of the time it's lack of time that is causing a large part of our stress anyways. But I always think there's hope. Some big causes of stress can't be changed, like an illness or a relationship ending. But outside of those big stressors, you can try to find those small stressors in your life that can be changed and tackle one of them at a time. Making those little or big adjustments can help you to get in a better mental space. And if you do have the time, certainly counseling, meditation, and other forms of stress relief could be helpful. I'm no guru on stress, and I'm certainly no stranger to it either, but I always believe there's room for improvement, and it certainly won't hurt to try. Check out all these cool facts about the eyes. This here is one of my favorites.